I was the first person in Rockford to bring a non-narcotic approach to orthopedic surgery. What I was noticing between 2010 and 2015 was the significant difficulties I was having with narcotic pain management. It was very common for the patients to not be eating well after surgery. I found that the patients did not sleep well on narcotics. They would often come to the office looking a little bit pale. Their eyes would not look very bright. Sometimes I would find that they would be requesting narcotics for a period of time longer than I felt was comfortable, longer than I felt was healthy for them. My goal was to eliminate the use of narcotics at all in the patients. I was able to do this with a technique that I had learned in 2008 while I was meeting with some other surgeons from another country that were providing support for their patients via catheters and the use of local anesthetics. I adapted that then to my practice because I wasn't able to send patients home with catheters with the American health system. But what I was able to do was to provide very careful injections in the joint around the time of the surgery. The other thing that we were eliminating then was the use of narcotics during the anesthetic. What we found when I started in October of 2015 was that even the most infirm patients that I was operating on were leaving the hospital in a day. The patients were urinating better, they did not have constipation, they weren't treating itching, and the mental status of the patient was much better. It was not unusual for a patient to come back from surgery and then stand up at the sink and shave, and then go to bed and read a newspaper. Next, I noticed that the office wasn't burdened with frequent patient calls for things like itching, constipation, confusion, poor sleep. Now I'm able to do it in just about everybody. If a patient requires narcotics, and some do, I want the patients to be comfortable. By removing those drugs from the patients, the outcomes have improved considerably. It was the single most advantageous technique that I added to the practice. And when I went to our national meeting in 2015, in a room full of about 1,000 surgeons, there was only a handful of us that raised our hands that said we were using a non-narcotic or very limited narcotic approach. Now if you go to a room of orthopedic surgeons, the whole room, or nearly, is raising their hand that they're doing it. I think because I've been doing it so long that I feel like I'm as good as anybody and probably better than most at providing a non-narcotic approach.